ezulwini ndibona izinkwenkwezi na imvula ivela phezulu. Umoya wami uyakuthumisa, umukhulu, umukhulu. Umoya wami uyakuthumisa, umukhulu simangate.
During my volunteering, to be honest, one of my client, which is I helped to get the support, because they came here in December 2020, end of December, but they didn't have a support, which is, the Aspin card didn't arrive for more than 2 months, which is they should get the support as soon as possible. But after 2 months, so Refugee Council referred me to call this person and if they need anything. But as soon I called the person, which is he has no money to eat and no food, even no food to eat also. He hasn't got anything, so I've tried to call the migrant help for the support, emergency support. So I've sorted out these things to this person, which is, it helps a lot to this family. To be honest, it's very difficult, because if you don't have an interpreter and you don't know what to say, and you can't, get like what you want. Yeah, because you can't explain, what's your situation, if you don't have your English skills. One of my client, also the family, who just arrived like in 2019, which is her mother was here, but she got the refugee status and brought her daughters to here. So during the lockdown, which is everywhere is an online study, but she has last year of university, in college, which is she's trying to study for the medicine, to be a doctor, but she doesn't have a phone to study, so I just asked Rose for the Refugee Council to refer some, for the phone, anything top up like that. So I got the phone for this family, which helps a lot to this little girl, to study her for the college.
Yeah, so I think it's quite a skill really, and it's one that you learn over time of working with interpreters. So what I like to do and what I teach my students to do is, if you have a face-to-face interpreter, they're sitting over there somewhere, okay, you are speaking to the woman and you are speaking to her like you're just having a two-way conversation, and the interpreter is just in the background, just being a voice for the woman. So you're not speaking directly to an interpreter, you are speaking directly to the woman, and it's using lots of personal pronouns. So how are you today? And what, are you feeling the baby moving, and what are your worries, things like this. And also, when you're working with the interpreters, keeping it very short, so using maximum 3 sentences at a time, speaking slowly and clearly, so that the interpreter can relay back easily what you're saying. And also, debriefing the interpreters when you first get on the phone to them. So for example, we run the FGM clinic in Leeds, so we always like to start off by telling the interpreters This appointment is going to focus on FGM and talking about that and making sure that the interpreters know what they're about to interpret for, because that can be quite a lengthy appointment at 1 hour, and it can be quite emotional actually, and very emotional for the interpreters as well if they've been through that sort of experience themselves. So
I'll tell you the two experiences. Like first, I used interpreter myself before like being an interpreter. When I did not had an interpreter, I was feeling really difficult to communicate my feelings, particularly because English is my second language, it's not my first language. So my mind thinks in first language, and then when I have to communicate my feelings, I was not able to do justice, or I was not able to communicate properly what I'm feeling. Like when I was talking to my therapist, I was like feeling, oh, there is a need for, you know, like someone who I can just say what I feel like, instead of looking for particularly words and searching words in my mind. Instead, you know, just telling her how I'm feeling about it. I felt like a bit lost there, like I couldn't tell her exactly what I'm feeling. And then now I am an interpreter, I'm a volunteer interpreter. So yeah, the very first thing, people don't know the interpreter, what is his role, how you can get an access to him, and what he can do for you. So the very first thing people needs to know, like, okay, there is an interpreter facility available. Like, you don't need to struggle. You can ask your GP even that, you know, I can't speak English, I need an interpreter. But people don't know that, you know, what interpreter is. Like, I worked in several countries. I never used an interpreter because, you know, there was no such concept of interpreter outside. Yeah. So for me also, it was a very new concept when I came here. That, oh, if you're speaking different languages, you can use that.
Like big challenge during the COVID, it was interpreter going to the dentist, like because as a volunteer it wasn't allowed to go to interpreter as refugee council didn't allow, because it was about the pandemic. And I went by myself. I take my own risk, and like it was for me something. When I go home, I said, wow, if I catch virus, if something is going to happen to me, like why I'm doing things, like why I'm doing too much. But inside of my heart, I felt to help my friends, because so many times they went for dentist appointment, hospital appointment. In Rotherham, to be honest, in Rotherham we have very bad service interpreter. Like too many of my clients, like they lost their appointment because of the interpreter. Sometimes it was things like let's say emergency, and they didn't have interpreter. I have to go in emergency to interpret for them. It was a big challenge, like challenging with my health. Yeah, but now everything went good. Now I feel proud.
First of all, I think, like, you know, there should be someone to listen the conversation between the interpreter and the client. Because, you know, I have one flatmate, and she told me all this thing later on. She said, what I was telling to the interpreter, you know, he was between the conversation between the GP and then, you know, she said it was self-judgment of the interpreter. He told her, why are you telling so many problems? They are going to do nothing with your problems. You know, be like limited as much as you can. No need to tell everything what are your problems. Who gave him this, right to judge the patient? No one.
There was a session going on. It was very emotionally exhausting for me, and I could hear in the background like the interpreter was not fully attentive to our conversation, like he was, because it was on the phone, so, you know, like maybe he was busy with some other stuff, and he didn't introduce himself properly, like what his role in the session, what he's going to do for me. And sometimes he missed a lot of part of it because the attention wasn't there. So that was my part. Like, they needs to be very professional, like a doctor, like any other profession. Yeah, it's not just like you say something, I'll just interpret in another language, that's it. No, it's a very technical field. You need to be technically qualified to do interpreting. Otherwise you can mess a lot of things. I know one case, if I can say that case. Okay, so The interpreter used his own words to describe like a person who was using his services, which he didn't say. But the third party who got to know about him is like, if you're contradicting with one point of view, then why you're using such words? He said, I've never used it, the interpreter used it, like on his own, just to like molding the conversation, like adding his part into it, which is not required. And that messed whole case.
And if it's a female, it's talking about her female problems, it's a culture barrier, it's a male interpreter. It's need to be, see, how come in the breast clinic there is and he's asking about when did you go your last time, your periods, how's your sexual life? Excuse me, it's a man and you're expecting a woman to give you all these answers. My flatmate, she has a breast lump, and she explained this thing to the interpreter, and he did not told to the doctor on her first appointment over the telephone during the pandemic. It was not face-to-face appointment. And one day she just almost a month later, she was just talking to me and she showed me it's hurting. And I said, why you didn't told to your doctor when it was your first appointment? It was the interpreter. And then she become little friendly to me. And then I called to the GP and informed them please make sure it will not be the same person. And then they called her same afternoon for a physical appointment, and they checked it, they sent her for scan, and they realized that she has to start ATT. So it's because of she been missed on the early stages, she started her ATT 3 months later. So it's it's not safe. The people who we are living in that environment, we can we are not having a healthy food or healthy environment. So once is infected someone in the house, you are very much afraid of getting all those things.
I mean, I try to resolve it as much as I can, but it's not always positive. But I share one of the positive with you. So a friend of mine, he's an old man. So he had a pain in his shoulder for many months maybe. And when he used to go to the GP, they didn't understand why, and he couldn't explain it. But because he's kind of old, traditional, stubborn man, he didn't want to ask for any help. Maybe he was shy, I don't know. So after a while I said, why you haven't sorted out your shoulder yet? So he said, the doctor don't understand what I'm saying, and I don't understand what they're asking me. So we went to the GP, but that process took about 2 or maybe 3 months, less than 3 months. They referred him to the physiotherapy specialist. And then I've been there every steps with him to the GP and then to the physio. So he could go to the physio to have some physiotherapy on his shoulder, some kind of activities. And now he's okay. That was one of the problems. So language barrier, and then shy asking for help maybe.
So for interpreters, I just want to say, please think about that. If you are on that person's place and you've been misdiagnosed, and that it's how much it hurt, because you can speak English, I cannot speak English, and I cannot convey my message to the doctor, but you can be my eyes or you can be my voice. And when I know you are not doing your job properly, how much it hurt. I wish you could be on my place.
We found in HARP that often interpreters are not being used, whether that be for GPs, dentists, midwives. It does vary an awful lot from one place to another, and I often wonder why. I remember challenging one dentist because there was somebody who was homeless who had terrible toothache, and the dentist refused to see them unless they provided their own interpreter. So this homeless person actually paid for an interpreter to go with him. Now we provide interpreters through HARP, but they're not trained by the NHS, and the NHS has an obligation to help people to be understood, because everybody has a right to be understood.